Good afternoon, and thank you for joining us for this Kinetiq Health webinar on benefits consumerism. My name is Toni Stinson, and I am the director of Apex Academy. And with me today is our senior account executive, Brandy Pardo, who happens to really enjoy the topic of benefits consumerism. So before we dive too deeply into this, I do want to share a couple of items for housekeeping. All attendees are going to be in listen-only mode for the duration of the webinar. But we do welcome your questions and comments, so please use the chat box that's located on the right-hand side of your webinar screen. For audio access, you can also use the computer as well as the call-in for the phone option. And if you are looking for a copy of the presentation slides that we're going to be going over today, please feel free to download those by clicking on the icon on the right-hand side of your webinar screen. We've got a few things that we're going to be talking about today. But most importantly, we're going to talk about consumerism.
Yes.
And it's something that we have been hearing about in this industry for decades now. How would you describe consumerism in the healthcare world?
Well, the best thing for me to do to describe consumerism is to talk about something that we all have to do as consumers, maybe every few years on our vehicles. So consumerism, if I have to go get the tires changed on my vehicle or get new tires because mine are bald and balding, I'm not going to take my vehicle to the dealership and say, I need 4 new tires, because we all know that they're going to give us the most expensive tire. The labor charges are going to be exponential. It's going to cost an arm and a leg to get that done. So what we do as consumers is we call around. We call around to the tire shops to find the best price tire or to find where it's going to cost the cheapest to have them put on, so that we are keeping dollars in our pocket. And that is how I describe consumerism.
It's funny that you would mention the tire situation. It's something that we just went through with my husband. And he actually has worked in car dealerships his entire life, and this was the process that he went through. So even those of us in the healthcare industry have to be reminded sometimes about what it takes to be a good healthcare consumer.
Right.
So you have put together for us 8 ways or 8 tips for being a savvy healthcare consumer. And we're going to go over all of these in some detail over the course of the next 27 minutes or so. Let's start out with that top one there about knowing where to go. Why is that so important for us to keep some money in our pockets?
Well, knowing where to go for your health care means knowing that what you're going to pay out of pocket or what you're going to keep in your pocket. For some clients or for some employer groups, they give access to a clinic, a near site or an on-site clinic. And that means for the member that there's $0 out of pocket for utilization of that clinic. So knowing that you have access to one of those things where you're paying $0 out of pocket. Knowing that for sickness, you have access to telemedicine that's not going to cost you anything, or is only going to cost you a certain amount for 24/7 care. Going to your primary care provider on a normal basis during office hours, again, copays or minimum dollars. But when you get those things in the evening, like needing an urgent care, do I go to urgent care or do I go to emergency room? Well, going to an emergency room is going to cost you twice as much as it were if you were going to go to urgent care. So knowing what you've got going on and making sure that you're getting to the right type of provider for those things is going to be super beneficial in how you're going to spend your dollars.
Absolutely. And I know that most of the people who are watching us are part of a network plan, and they have been told that the best way to get value out of that network plan is to stay in network. But are all network providers the same?
No, they're not. There are some carrier providers out there that have a deeper discount at one hospital system versus another hospital system. There are actual providers or doctors that are subcontracted within hospital systems that may not be attached to a network. So when you go to have that service done, whether it's at a hospital system or even in your physician's office, it's advantageous to ask, is my provider in network? And if they're not, then asking for another provider if need be, so that your costs aren't paid as out of network expenses.
And if at any point in time I am disagreeing with the diagnosis that I'm getting, I'm not feeling as if the care plan that they're setting in front of me is something that's going to work for me, what do I have in my plan that I can do?
Well, first and foremost is you are not tied to that provider. You, as the patient, have rights to go somewhere else and seek another opinion or a second opinion. So if you've been diagnosed with something that is super big, the cancer or some other hemophilia that you feel like you really need to speak to another physician, maybe another physician's going to explain some things in a manner to which you understand better. Maybe the care is going to be closer to home. You don't necessarily have to go to that first provider, but you do have the option to get that second opinion for your care.
And even if you don't end up going with that second provider that you're checking with, it does give you some peace of mind.
It does.
Now, there is a lot of talk about price transparency.
Ooh.
There have been laws that have been passed. We could sit here and spend the next 23 minutes debating the value of that. But how can I, as a healthcare consumer, go about exercising some knowledge about pricing transparency to my benefit?
Well, due diligence, obviously. If you've got a procedure that's coming up, if you've got some place that you've been referred to going, you can always call that provider and ask, what's this going to cost me? What's it going to cost from the provider? What the provider's going to charge, the facility's going to charge, maybe the anesthesiologist. You can ask for that price transparency up front. There's also freestanding centers out there that you can utilize, whether it's imaging or labs or even surgery centers that sometimes will have their pricing right online. Northwest Radiology. Not too long ago, I was told I needed to go get a bone density scan, and they asked if I wanted to go downstairs from the hospital system, and I said absolutely not, because I know that I can go on Northwest Radiology and it tells me right on their page exactly what that bone density is going to cost me. So I knew what I was going to be paying out of pocket versus doing it at the hospital.
So much more convenient to go just down the hall or just downstairs, but a lot of cost savings to be had if you're going to be looking for a freestanding facility.
Absolutely.
Now, sometimes it can be really counterintuitive that in almost every one of your open enrollment meetings, you're going to be asking people to use their preventive care benefits. And here we are telling them, go to the doctor, use these benefits, have these claims because it's going to be cheaper. How does that work?
Well, kind of like being a good consumer on our tires. Taking care of our vehicle means that we get it into the shop to get the oil changed on it, to get the tires rotated so that they last longer, to get all of the fluids checked within our engines. We, as human beings, also need to do the same thing. So part of that preventative care is for our doctors or physicians, primary care or at the clinic, are looking annually at us to see what's changed, what needs to be paid attention to, what kind of medications do we need to be on to get our blood pressure down so that we don't have the heart attack, or we don't have to have those stents put in or the heart transplant, so that we're managing our diabetes and not going into a diabetic coma, because those things very quickly can get out of hand. So checking in once a year for those exams, like your annual wellness exam or your annual biometric screening, or for women, our annual mammograms and PAPs, and for men, the PSA or the colonoscopy. All those things super important in catching the things before they become big things.
And that's a savings both on cost, because those other things that they develop into are expensive, but it's also a quality of life situation.
Absolutely.
I'd much rather have something that I can manage with a medication than something that's going to set me into the hospital.
Absolutely.
And the great thing about the plans that they're written now is that there is 100% benefit for preventive care, paid by the plan, no copays, no, not subject to the deductible, as long as those services are on the list as defined by Health and Human Services.
Yep.
Now, you and I both know that there are some challenges to that. For example, if I am already diagnosed with a condition and it is being managed by medication, for instance, and I go in for a preventive care benefit and talk to them about that condition, what impact can that have on this claim?
Well, what you're going to get is balanced billed from your provider because your provider has sent that in as a diagnostic code versus a wellness code, a preventive care code. And so that means that you get the bill. So if you're on a high deductible health plan, you're paying for that out of pocket. What most don't understand is that if you've got some chronic care conditions that you're managing and you really need to talk to your physician about that condition, or maybe some ailments or your hip or your shoulders are really bothering you, and that's something that you wanted to bring up, I would schedule back-to-back meetings or back-to-back appointments. The first one for your wellness exam, if that's what you're scheduling to go in for, where you're only talking about your weight, your blood pressure, all those things that they check off on the list for that wellness exam, so that when they're coding that claim, it's coded as wellness. And then have that second appointment where you're talking about all their other ailments, because those claims are going to go in as diagnostic.
And one of the other things that we see with relative frequency, you had mentioned previously colonoscopies, going under the anesthesia when the full complete understanding that this is a preventative colonoscopy, and waking up afterwards finding out that they've discovered polyps and they
Yes.
took care of them, and that changes the diagnosis on that colonoscopy from preventive to diagnostic.
It does.
So is there a fix for that?
Other than telling your doctor, please don't fix anything while you're in there, which you really kind of want him to, just going in understanding that this particular procedure can go from a wellness exam, but if he has to do anything in there and it does get switched to diagnostic, it is going to be the plan member's responsibility.
But the good news is they got it while you were under. You don't have to
Absolutely.
go through that process again.
And that's the worst.
It absolutely is. If you don't know that firsthand, I wish I were in your situation.
Absolutely.
So I have two very brilliant sisters. One is an engineer, one is in media, and it never fails that whenever they have insurance questions, they come to me and say, I don't understand my policy. So it is a very complicated situation. Insurance is very complex, lots of moving parts, but we're asking people to understand their insurance plan to get the best value out of it. So how would somebody go about doing that?
Well, first and foremost, we all have to have access to our summary benefits, or SBCs, and our summary plan documents, or our SPDs. And that's just part of the compliance that, as an employer group, you are supposed to have in your hand at any one given time. That way, if you have questions about what's covered and what's not covered, you have that. The SBC, or that summary plan, or the summary benefit document, is usually in that blue and white, where it's very simply stated that, who's covering it, whether it's outpatient, inpatient, whether it's an x-ray or diagnostic, how much is your responsibility, whether that's your deductible or your out-of-pocket maximum or the co-insurance percentage, how much is your plan sponsor's responsibility, and then any side notes, typically like if there's a clinic that you have access to, or a very particular pharmacy benefit manager that you have access to, in the side column. And then on the back side of those, there's typically examples of how you can utilize that, so that it kind of explains where that deductible and co-insurance and out-of-pocket maximum kicks in. Then you have the summary plan document, and that's where the details come in light. So this will tell you what's excluded, what's included in your care. And if you're looking for something very specific, like maybe you're looking for a diagnostic breast exam or something like that, you can actually pull that up in PDF and put what you're looking for up in the search, and it will pull up that word or words up within the document, and you can just skip to the section where you find is relevant. Other than that, I would rely on your HR manager to explain what's covered and what's not covered. And then, as always, you can call the carrier directly, because they can explain any of that in full detail.
And there are some limitations that plans have to the frequency, for instance, or how often or how much can be covered in any one visit. So those are also included there. The thing that I think people may miss spending time on, and I don't advocate reading the full 140-page SPD unless you are having a difficult time falling asleep, but there's a really important section in there called the appeal rights. And Why is that a really important section?
Well, because for someone who's going in for a procedure, maybe a prior authorization that's getting denied and you want to file an appeal on that, it could be something as simple for that appeal is that your doctor just didn't provide the right notes to the carrier so that they can approve the surgery. The same with a claim. Maybe that prior authorization was approved, but when the claim went through, the claims carrier did not get the correct documentation from your provider. So now the claim's being denied. That appeal process allows you as the member to take responsibility in pushing your provider to get the carrier the information they need so that the claim can be approved. And that's not your final financial responsibility on the back end. Once one claims appeal has gone through, if it's denied, there's typically a second try that you'll get with that. And if you get to that second try, I would involve as many people as you can, your HR department, your broker, to advocate on your behalf. But there is that appeal process because there is usually a reason that something is denied, whether that was relayed beforehand or something that you didn't know until afterwards. That needs to be communicated as well with the carrier.
Absolutely. So when somebody goes in for services, I had this experience several years ago. I got to see many, many parts of the healthcare system right up close, and I got many, many bills. When everything's coming in, it's really hard to understand who I owe what I owe to whom. So how do I justify that? How do I put some sense around that?
Well, first and foremost, your carrier's going to do what they do, and that is send you an explanation of benefits. So when the provider files that claim with the carrier's going to send you something that says this claim was filed, this was the date of service, these are the people that we've paid for this, this is what was billed from the provider or from the facility to us as the carrier. This is the portion that we've negotiated in our pricing.
Mhm.
And then it separates out what your plan sponsor has agreed to pay based off of your contract, and then what your responsibility is as the member. So when you get that bill from your provider,
Mhm.
assuming that you don't get it before you get this explanation of benefits,
Right.
let's hope not. But when you get that bill from the provider, you want to make sure that the dates of service and what they're billing you for match what that EOB from your carrier is telling is your portion of the responsibility. If it's not matching, then that's when you go back and ask questions. You can call the carrier directly and ask questions. They can answer. If it looks like something on your provider's end, you can call the provider and ask why you're being billed this amount. What happens 9 times out of 10 is people get the bill from their provider way before they get that explanation of benefits,
Yep.
and then they pay the bill.
And that presents a whole different challenge.
Oh, it does, because if you pay the provider, what's to say you're going to get that money back?
Right.
So let's wait until that explanation of benefits actually comes through. Sometimes that claim has been pended for longer than it should be. Maybe we have a responsibility to send in a coordination of benefits. Who was responsible for this in actuality? And if you haven't sent that in, they pinned it. So there's lots of reasons that could hold that up, but you really do want to make that comparison from the EOB to the provider bill so that it's matching.
Absolutely. And if you start getting those provider bills in before the explanation of benefits, it's really important just to save them off to the side. One of the things I think people may not be aware of is the bills are processed or the claims are processed in order of receipt, not in order of date of service.
Right.
And sometimes doctors' offices are able to get their claims in quicker than hospitals. Hospitals have larger bills, and so frequently, if I get my bill in and start paying people based on what happened, what services I had first, I may be overpaying a provider that the insurance is actually going to provide a payment for later.
Or double paying.
And that's a challenge to get that money back. So definitely it's important to wait until that explanation of benefits shows up. And sometimes there is a whole generation of people that is counterintuitive. They get a bill, they want to pay a bill.
I get it.
And that's great and everything but this.
I'm a checkbook girl, so I like my checks and balances.
Absolutely. So we see consumerism all the time everywhere. We're talking about healthcare, but you highlighted tires and shopping for those. We do it for travel, we do it for real estate, we do it for our cars. All of those other things seem to have a lot of tools to help us make those decisions on price and where we're going and what we really want. What's available for healthcare and helping us make those decisions?
Well, we've been fortunate enough that technology has come a long, long way. And there's a lot of things right at our fingertips that we can utilize right this moment to figure out what we want to do to make these decisions. Carriers are really coming along. And if you're not someone that likes a mobile app, they usually always have the same services or the same technology on their websites online. Or you can always call that 1-800 number on the back of your car to get the same information. But the great thing is that if I've got a provider that I'm looking at, or I want to find a provider that's in network, where do I find that? I can typically go to those mobile apps to look up provider to see which one's in network. Maybe I have a tiered plan that has a tier 1 and tier 2, where it'll tell me, is this a tier 1 provider or a tier 2 provider, which is very important because it's less dollars out of my pocket if I'm going to the right place.
Exactly.
The other thing is making sure that as I'm looking for providers, but not only that, pharmacies. Where's the nearest pharmacy that I can get this medication at, this particular medication that I'm looking for? Then tracking those dollars, all the dollars that I'm spending out of pocket, whether it's my deductible, my copay, is it all tracking towards my out of pocket max? Where am I in that? And my responsibility, what has my plan sponsor paid? You know, maybe there's a portion of that I could be paying with my HSA dollars, which would be great. But now I can track those live online. So as soon as those claims are being processed and completed, those are going and being tracked towards those deductibles and out of pockets. And then there's wellness programs. Like I'm tracking my steps. I'm logging that I had my annual wellness exam or biometric screening. Maybe I have access to health coaching or nutritional stuff like different recipes online for nutritional. And then, of course, the most important is my digital ID card, because now I don't have to carry it in my wallet. I can just pull it up on my phone and show that to the doctor when I go check in. So lots of tools there that we can utilize, obviously, or we can call in to the customer concierge to find out this information that's on the back of our card.
Absolutely. So you had mentioned the tools that are available to help find pharmacies. And so we know we have a lot of people who are using their health insurance largely for the pharmacy benefit. We also know that pharmacy benefits are both expensive and likely to continue to be increasingly so. So how can generics help our members to save some money?
Well, generics probably at one time were some very expensive brand name medication. And because they've been around for a while and we've been able to create medications that are very, very similar, they have the same active ingredients, the same outcomes when we take them. They're similar to the effect in most patients when they use them or utilize them. They are at a much lower cost. Some of them even zero cost if you're doing some online shopping through that. The difference is active ingredients within the medication.
Yep. And so last night, my son just made some chocolate chip cookies. And if you think about the chocolate chips being the active ingredient, right? That recipe didn't tell us specifically what kind of flour we needed or what kind of sugar or where to buy the eggs or the butter. And so he just used the recipe that was already there. And that's really what generics do, is they use the already tried and true recipe that the brand name medications have been using while they were under patent. And you get the same outcome then. Now, I know you, and you are a very curious person. You are not shy to ask questions. That is something I share with you. But it can be kind of intimidating for some people who don't work in this healthcare industry to be able to find the confidence to ask the questions because they don't really want to feel stupid. So let's give the confidence to them for the ability to ask those questions? Why is that important?
Well, first and foremost, there are no stupid questions. And I know that we use a lot of big words and acronyms in this industry. So just making sure that you're reaching out to your experts, your HR, your carrier providers, and asking those questions on guidance and where to get your care, what this actually means. If you're not understanding, getting that second opinion, and it's okay to get that second opinion, because then that just means you're getting someone else's viewpoint and you're hearing it in a different manner. Obviously, human resources is your best way to go. And if they don't know, they can reach out to their broker, because that's what we're here for.
Absolutely. Now, I mentioned a little bit earlier that I had the opportunity to go through the healthcare industry very up close and personal a couple of years ago. And I will admit, I've been in this industry for over 20 years, and it was still a very frustrating process for me. So my parting thought for our members that are listening is just, I know that it's easy to get frustrated. There are systems and tools and resources for you. You have the help. Ask. We are here to assist you. Your human resources is here to assist you. Don't let your lack of knowledge about what you're personally going through keep you from getting the information and the answers that you need.
Absolutely. And then just know that as the patient, you have total control over where you get your health care, who you're receiving that care from. If it's non-emergent, you're allowed to ask for those orders, to take your order and go to a freestanding imaging center or a freestanding lab or a freestanding surgery center, so that it's less dollars out of pocket for you. You don't have to go within the hospital systems to get that done if you choose not to, but it is in your control as the patient or the member. And just know that that's your right. And then utilize every resource you have to keep as much dollars in your pocket and to be as knowledgeable about what you've got going on as possible.
Absolutely. We are available for any questions. If there are any comments that we need to address or any questions from the group, we're happy to take those at this time.
See any right now?
All right. Well, thank you all very much for joining us. We will be having another Kinetiq Health webinar next month, and we hope that you can join us. Thank you all very much, and have a great day.